Hello, everyone.
Hey.
We are just launching on live now. Oh, I forgot to do.
Your Worship, I think you shaved early.
Thank you, ladies and gentlemen, for joining us today on this Facebook Live information session. My name is Drew Ferguson, Public Media Relations Coordinator for the Grey Bruce Health Unit, and I'll be your moderator for this session. Joining us from Public Health are the Medical Officer of Health, Dr. Ian Ara. Also online are Bruce Grey Owen Sound MP Alex Ruff, Huron-Bruce MPP Lisa Thompson, Bruce Grey Owen Sound MPP Bill Walker, and Grey County Warden Paul McQueen. Unfortunately, Bruce County Warden Mitch Chulin was unable to attend. And I'd also acknowledge Township of Southgate Deputy Mayor Brian Milne has enabled local Mennonite communities access to this forum in a manner that's appropriate to their community. So we appreciate that. So following my introduction, the format of the meeting will begin with a brief opening remarks from each of the members, concluding with Dr. Ara, who will provide some context. And following that, we'll open it to the participants and the audience questions. Please use the message function on Facebook to put forward your questions. Those questions will be sorted and relayed to me and then put to the participants. I also have a number of questions that have been submitted earlier and we'll go to as well. If time does not permit all your questions to be answered, please forward them to Public Health through our Contact Us page. That's on our website, and we'll respond to all inquiries. That mail again is publichealth@publichealthgraybruce.on.ca. And please note this session is being recorded and will be available on the Grey Bruce Health Unit YouTube channel. A link will be provided as soon as it is available. And as you know, the Premier announced the reopening of a number of sectors in the province, and Grey Bruce was among the first to reopen. So that'll be the basis of this discussion. To get things underway, it's my pleasure to introduce Bruce Grey Owen Sound MP Alec Ruff here to begin with. Take it, Alec.
Yeah, thanks so much, Drew, and thanks everybody, especially you, Dr. and the whole health unit, for organizing this tonight. I'll keep my remarks quite short, as most of the reopening is geared from the provincial level down. However, obviously there's businesses and programs delivered by the federal level that people may be interested. They will assist in getting that reopening up and running, and especially with as it ties to potentially protective equipment and just regulations. So thanks again. I think the key to all of this and a successful reopening is for all of us at all levels of our political representation. We're working collaboratively and cooperatively. So thanks again for hosting this, and I'm looking forward to the discussion.
Thank you very much. I'll ask comments from MPP Lisa Thompson.
You're on mute, Lise.
There we go. First of all, I would like to thank Dr. Ara and Drew and the Grey Bruce Public Health for hosting this forum this evening. I think nothing's more important than communicating during a time of crisis. And I feel Grey Bruce Public Health, congratulations. You have been very proactive and very successful in your communications and outreach to all of our communities. And to everyone listening, I'm sure you join all of us when I say a sincere thank you to all of our frontline healthcare workers, as well as our first responders who have dedicated themselves over the past number of weeks. We're into 3 months now. They've dedicated themselves to best practices to minimize the community transmission of COVID-19. And we owe it, quite frankly, to all of them to continue to follow the guidance from Public Health in order to preserve what they have worked so hard to achieve. And then by doing so, I'm positive that in our region of Ontario, we'll be able to move forward and go ahead and confidently enter stage 3 once we get the go-ahead from Public Health and we have the proper guidance to follow. I look forward to the discussion this evening.
Thank you very much, Lisa. Bruce Grey Owen Sound MPP Bill Walker, please.
Thank you very much, Drew. And I'm going to start actually by saying congratulations to all of the graduates across Ontario, but particularly in Bruce Grey Owen Sound. I did a video today and I said everyone from kindergarten to grade 8 to high school to college, to university, but who I forgot to say were all of the apprenticeship and trades grads as well. So I want to add that in there. A belated happy 60th birthday to Deputy Mayor Millen, who has graciously helped in a different manner. So thank you for that, Brian. And I want to echo both Lisa and Alex. Dr. Era, you've been absolutely stellar, you and your team, through this whole unprecedented, once in a lifetime, hopefully ever, situation for all of us. You have carried us through with good guidance, with good mentorship. You've ensured that the health and safety of the people of Bruce Grey, Owen Sound, and the province are your first priority. But you've also done a stellar job, I believe, to balance the needs of business and individuals who are also suffering through this in different manners. And I think it's going to take all of us collectively to continue to do that. Obviously, health and safety, people moving around, the safety of social distancing, the hand washing, all of those things that you say. But I think the other piece that you've really done a stellar job at is the mental health aspect, and making sure people understand that there are repercussions not only from the day-to-day activities, but those activities day-to-day that we're not able to partake in. So to you, to your team, to all of my colleagues around this forum today, and to you as well, Drew, I know a lot of the behind-the-scenes communication work has your signature on it. So to everyone out there, like Lisa, like Alex, and I'm sure Warden McQueen will say, thank you so much, and look forward to being part of it as we go through. And we couldn't do it without you. Thank you.
Thank you very much, Mr. Walker, and I'll pass it over to Paul McQueen.
Well, good evening, everyone, and I feel this is quite comfortable to the panel that we have here, because I think for the last 3 months we've been getting together for 2 or 3 times a week, and along with the great guidance of our Dr. Era from the Rivers Health Unit, and we work very well as a team. And again, here we are tonight, and ready for the questions. I'm just going to echo all the points that have been raised, and good points there. Certainly, as myself as a warden of Grey County, along with Mitch Tulin, who is the warden of Bruce County, and just a shout out for him. He's been working hard, and he's also the chair of the Grey Bruce Health Unit board. And I'll leave it at that, other than July 1st is coming, and you know what, we've got 6 months through 2020. Who knows what the other 6 months are going to look like, right? I was asked that today on the cable, Rogers Cable interview today. So anyway, I'll leave it at that, and welcome everyone, and look forward to everybody's comments. Thanks, Drew.
Thank you very much, Warden McQueen. Now, to take us to the matter at hand, the Stage 2 reopening in Grey Bruce, Medical Officer of Health, Dr. Ian Era.
Thank you, Drew. Thank you all. I'm honored to hear your comments. Thank you. It is June 2020 and June 24th. We continue to maintain 0 death. We have 0 death in Grey and Bruce, and we continue to maintain this 0 hospitalization at this point. Total of 3 that recovered. Number of cases close to 100, over 100 a bit. The 0 death is a metric on its own, and it's a real success. And you know, this doesn't happen as a coincidence. There are 5 pillars that I think of that really helped achieve this goal. The most important one is the public that's informed, that's not afraid, that has implemented the recommendations from the government, from public health, and has achieved the great result we have. It goes without saying, the healthcare system, their readiness, their work, their ability to be there whenever needed. Luckily in Grey Bruce, we haven't had death or the limited number of hospitalization, and the healthcare system continue to be our insurance policy if we're heading into any period that's different from the previous times. The community partners, whether it's small business or corporate business, namely, I can thank Chapman's Ice Cream and Bruce Power for the generous donations, timely donations, to prioritize anything they have to the community and the healthcare system. And public health, by definition, is the center for the management of pandemics. And I am very proud to be on a team in Grey Bruce that has been burning the candle at both ends to ensure communication is in place, to ensure recommendation is timely, and whether it's the infectious disease team at the start of the mitigation period of the pandemic, or the environmental health team helping in ensuring safe plans for businesses and organizations to be ready there, for these businesses to be proactively ready to hit the ground running when we receive the green light from the province, and we have. And the final pillar that many people don't see just because it's behind the scene, it's the political commitment. Political commitment to health. I mentioned it before. It's a term that you can measure, you can study, you can see the results of. And I am privileged to be in a system where the commitment to health from the political level, whether it's the municipal or provincial or the federal, has been paramount to allow practitioners on the ground to do the work that we have been working on. Again, I thank people around the table. This is really the direct result of your efforts in the past few months and for past years preparing to be ready for something like this. Thank you all.
Thank you very much, Dr. Era. Actually, we're starting to get some questions rolling in on the messaging, and one of the first ones is kind of a general question that asks you to sort of clarify the COVID risk locally and even break it down into demographics, if you would. What is the risk in Grey and Bruce?
So I guess that question comes to me first, eh? We continue to have very relatively positive results in Grey Bruce. The total number of cases is one metric of it, of the epidemiology. It's a bit over 100. And the number of deaths is 0. The doubling time is negligible. That's another metric. The people who were infected, people think that we have 108 cases or 111 cases today. That's all of it. No, this is just a metric. There are cases out there that we did not measure, that we did not diagnose, but that's quite all right. The shape of the curve would not change. If you go with selection criteria that's narrow, you're going to get low number of cases. You widen the testing as much as we widened recently, you would get more cases. If you measure the number of hospitalization, if it was higher, it will really, all of them reflect the same shape of a curve. So the number of cases many people think about as a success, it is success, definitely. However, the bigger picture is important. You look at the cases, they resemble a sample of the population. So we had early in the pandemic, people coming from travel, and that was the source of the infection. Around late March, April, it became apparent that the epidemiology points to community spread. That's to say, the people were infected locally. Many people talked about us versus them, locals versus cottagers. And truly, the epidemiology at this point reflects that both groups have been acting as one, following the recommendation, and the number of infections in the locals reflect the percentage of locals. The number of people who came to Grey Bruce is negligible again. Farm workers, that's a question of, we had one cluster of 2 cases with about 6 other people exposed. We've maintained to keep them 2 cases until they're recovered and all exposed successfully came out of the isolation period. So this is the breakdown of the epidemiology. It really, this disease does not discriminate against age. We have as young as 2 months and as old as in the 70s and 80s, and anything in between. Nobody's immune. Probably the most important part of the breakdown of epidemiology, the question that's asked here, the conclusion is any one of us, we need to presume we are carrying the disease. We need to behave as if we are carrying the disease. So we will take care of hand washing, of social distancing, to try to enjoy the best of our ability, our social network electronically within the 10 group bubble. We can be as close as we can. Having that awareness top mind that anybody could be infecting others would allow us to be compassionate with the most vulnerable of us who would suffer dearly if they got the disease, the older people and people with comorbidities. So in essence, the disease is still with us. People say we're tired of the disease is not tired. And we need to continue successful reopening, maintaining this outbreak control over it, but to open as fast as we can in a safe way.
Thank you, Dr. Era. Thank you. Top of mind for a lot of people are questions around face coverings and masks. One writer identifies as being troubled by what appears to be a low uptake on these measures in areas, particularly in stores and restaurants, by both staff, the store staff, and by the locals who are coming into those facilities. Comments with regard to will public health be enforcing, or how can public health enforce, and just your general discussion on face masks, face coverings.
Certainly. So face mask brings forward few questions. One of them, why is the recommendation changing? Is the evidence changing? And the simple answer to that one, and I realize it's not the direct question, but would lead to it. The first question is no, the evidence about mask has been established long time. If a person is using it in a healthcare setting, it is essential. People are trained to provide care, and they're also trained to handle PPEs and masks in a way that's going to protect them, protect their patients. Using the mask in a public setting has the tendency to protect the person wearing the mask, but at the same time, the tendency to touch one's face when wearing a mask would counter that effect. So the protection for the person wearing the mask is really not there. It's countered. The remaining balance would be in protecting people around the person wearing the mask. And that's where it's paramount to use it in the right timing. The right timing would have different factors around it. The most important two are if there is community spread. Number two is if there is contact among people. So if we look at the timeline for this pandemic, we were aware of the pandemic in January. I presented to the Board of Health late January saying we need to dust off our pandemic plans, same statement to the counties in February. However, if we implemented the measure of using a mask in public at that time, it would be futile. The disease is not there, the community spread is not there. Late March, April, there is community spread, but we didn't implement the measure because the contact among people was negligible or minimal. Most people exercised extreme social distancing that does not warrant using that extra measure. In other words, if I'm sitting in my living room alone wearing a mask, that's totally futile. Nobody's there, I'm not contacting anybody. In the reopening stages, and we have been through the first two of them successfully, that's where the mask use in public is paramount and key. So we have achieved the full control over the outbreak at the end of the mitigation, and we continue to do this. Right now, if we up the measures from strong recommendation to use the mask, that's a recommendation in Grey Bruce and most of Ontario, if we up it to an order, which makes it mandated, what extra benefit are we going to get? Probably none. We're already having full control. This is as good as it gets. There is potential harm of getting people fatigued of the measure and fatigued of the messaging about it. So if we need it down the road in 2-3 weeks, we already lost that period of time. So it's important, it's critical importance to wait until the last minute to pull the trigger to implement these public health measures, whether it's the social distancing, whether it's the different measures, including this one, the mask. So it's not, that's back to the question, is there a possibility to use it? Yes, it is. It's on the table. And the mechanism would be, probably the easiest one is an order from the medical officer of health to the public to use it, or to businesses to mandate it, to have it in their policies. However, we're in a really good condition just with recommendations, with education. And the principle of least intrusive dictates if you achieve the goal with education, there is no need for warning. And if it's with warning or recommendation, there's no need for an order. A bit longer answer than what the question asked for, but I hope it's useful too.
There's a bit of a secondary question here with regard to someone who may or may not choose to visit a store or an establishment where staff are not following recommendation. How does somebody make that choice, I guess, is what they're asking.
So it really depends on the person themselves, how vulnerable they are to the disease. If somebody with immunocompromised system, they had cancer treatment, they might look at any situation as risky and try to avoid it. On the other hand, if they walk into the store and you can see proper signage and cleaning, and by definition, every organization in Grey Bruce, to my knowledge, has been doing their best to open as fast as they can, but as safe as they can. You can assess that situation, how many people in the store, how much signage, how much barrier, and that decision could be individual. In general, Grey Bruce, as a business, as organizations, as businesses in Grey Bruce, they have been provided with the recommendation, with the tools, and they have been doing their best to provide safe environment for their staff and their customers. I don't know if that answers the question specifically.
I think that helps a little bit, yeah. I'm going to change gears here as we look towards Canada Day and this coming holidays. A lot of discussion with respect to the beaches, so let's open the door to that. What is your thoughts with respect to beach closures or beach openings or somewhere in between?
Who would you like the question to go to, Drew? All of us? Some of us?
Yeah, I think it really does apply to everyone. So we can go across the board. Who would like to chime in?
Well, I could maybe start. I raised this at our meeting just the other day at the county with regards to if the beach, with regards to Sabo Beach is closed for this weekend or this coming week. And we do know that it's just not July 1st, but basically this weekend to the following weekend is this long week that people are taking off. So it's going to be a period of time. And I'll just say that from what I'm gathering, campgrounds and facilities and sites they're booked. Everything is booked right up, and people are, and probably in fairness, from those visitors that we, do welcome into our community at other times, this is something that they look forward to this type of weekend. I think I was on a call with Minister Walker there, and he'll probably explain a bit more from his experience on that way. But so I raised this to the county group in the sense that of Grey, that if people are going there, it is closed. There's going to be, I think, quite a few people who will adhere to the closure, and they may branch out to other events or other sites or other things that they will. So I just raised the point to our staff that there may be a higher intake of other things happening in the county of Grey and presumably Bruce, as well as for those that do follow the closure and that, but there's probably going to be others that may not. So I know just as in Grey Highlands here, and we've had a situation where the Fletcher or the Eugenia Falls has been closed, and people do persistently continue to disobey those signage to say it is closed and that. So, there will be a concern there, I'm sure. And I know from South Bruce has talked about law enforcement and bylaw enforcement. And I know from our call last week, I think Jennifer Ormsby, district detachment commander, had said that they are going to bring more OPP into our area, and typically as other July 1st weekends are. But I think in the most part there will be people that will adhere to the closure, but there will be some that may not. So I'll leave it at that and let others colleagues speak.
I guess I'll weigh in quick just because my comments will be minimal, because most of this is obviously outside the federal jurisdiction. But I just think the most important thing that everybody has to remember, and everybody out there, whether they're communicating with friends and family, people that are coming up to the area to visit, is just consistency in messaging, and making sure everybody understands just exactly what's in place here, what the rules are, and what the health protocols that so they're consistent and people are following them, and not taking shortcuts, because there's so many factors tied to this, from the not only the health perspective, but obviously the economic impact that it has as well. And so we have to try to find that fine balance. And there's nothing easy about these decisions, but that's so be it. That's what we all signed up voluntarily to get involved with. So it's all good.
And hi, it's Lisa here. And I just might add that I really respect every effort that our local municipalities have given to follow the guidance from our public health units and Dr. Williams as well at the provincial level, because they do want to support our main streets, our small town main streets. And we recognize that that means having visitors come to our community. But in the spirit of consistency that Alex just spoke about, we still need to remember that COVID-19 is out there. There continues to be community transmission, and we all have to adhere by the guidance that is given to us, because what we do now will hopefully pay dividends in the future when we curb this completely. And I just encourage everyone to make the most out of their Canada Day. I know a lot of communities are doing virtual Canada Day celebrations, and I think there's a great opportunity to be creative and share out of the box thinking as we celebrate Canada Day 2020. I'm sure it's going to be a day we all won't soon forget.
Well said, Lisa, and definitely I think all of 2020 is one that none of us are going to certainly forget very quickly. This is no different than I think how we've started off the conversation and how we become one of the lowest areas of incident in the province, is people respecting and adhering to the guidance of our medical officers of health while balancing the ability for people to keep the economy going. Because there's what I continually hear on the opposite side is, if you don't have your economy and people being able to work and enjoy and raise funds for their family, there are going to be those things like mental health challenges on the other side of the health spectrum that we're going to actually have to deal with. So I'm gonna maybe be a little more direct. This is a very tough, challenging situation for everyone involved. I fully respect the municipality in the case of Sauble Beach, which is where we're really focusing the council there, to say they want to put in more stringent requirements. They want to go above and beyond what the province has said they need or have to do, and fully respect that. But I also think there has to be a balance of going after the people who are actually flagrantly breaking the law. And, the number has come out that you need 20 more police officers. I'm not certain who designed that number. I'm not certain if there was science used to come up with that number. I'll certainly work hard. As Mayor and Warden McQueen has said, we always get an additional complement of OPP officers for the summer period in the Bruce Grey Owen Sound area. That will be happening. That is planning to happen. If another 20 beyond that is even feasible to bring in. Other communities also need policing. Other communities need additional and enhanced. How do you stop once you give it to one beach to not expect that happens at every beach? And where are the realities of that? So I think we have to find a way to balance this. I think there are good precautions. And the reason why Dr. Era and team and all of the people, particularly the people of Bruce Grey Owen Sound, have kept the numbers down low, is because we've adhered to the recommendations of medical science and what we needed to do from the rules. So I believe that there is a balance here to say, we need to expect the people to adhere to all of those same conditions that allowed us to have the record we have, and go after the people who are flagrantly breaking it. I think it's going to be a challenge. We are a mecca. If you've been cooped up in an apartment or a condo or whatever it may be in any urban center for 9 or 12 weeks, people flock to our area of Bruce Grey Owen Sound and anytime in the best conditions, because they want to get away and they want to come out and enjoy all that we have. Mayor McQueen and Warden McQueen has seen it experienced in his area, where people again have gone beyond. Go after the people that truly are flagrantly breaking it, and ask those, especially those people, to respect and adhere, but go after them definitely with whether it's police or by law enforcement, however we have to do that. And the bulk of the people, again, I believe are respecting. The bulk of the people are adhering to, and I want to make sure that we treat them equally as fairly as the people who aren't, and we don't punish them. So it's a very delicate, I get it. Again, I don't I have full respect for mayor and council to be able to do what they wish to do. We all have different views on how we would manage things if in certain situations. But I think at the end of the day, we have to find a way to keep the people locally safe, the visitors who are coming here safe. And let's not forget, we don't survive in an area like Bruce Grey Island Sound if we don't have those transient people visiting our areas every year, not just this year, not just these couple of weekends. So I try to bring balance and focus to that. How do we encourage? How do we do it safely? And how do we do it within the limitations that we're all going to have? So, I hope we can all band together. To you, Lisa, I think I'm going to echo. If we all collaboratively work, if we all look and celebrate the spirit of what Canada really is about, is being there for our fellow person and enjoyment and pride in our country, then I think we'll get through this. And I just hope everyone will come to the table with open communications we have to this point and make sure we continue on that track.
Thank you, Mr. Walker. Would you care to discuss this briefly, Dr. Era? I know the one word balance that Mr. Walker used really applies to the position public health takes.
It definitely resonates with the position that we see and the science sees. And the word balance, actually, it's interesting that you would use the same word. It applies at two levels, at the practical level and at the scientific level. When you enter the reopening stages of any pandemic, the goal changes from mitigation. And the mitigation is to try to minimize the death and disease from COVID, which is something that we would continue to do. However, in the reopening, the goal becomes minimizing two variables: death and disease from COVID and death and disease from measures against COVID. And I can give a few examples about that type of disease or death. One of it is intuitive. It's mental illness and mental health. When people are locked in for a period of time, there is increased chance of depression or suicide. Domestic violence is another intuitive one. There is more chances for injury and possibly death. Then you go to the less intuitive heat waves. The least or the less affluent of us who cannot afford air-conditioned environment in the residence usually would go to cooling stations, beaches, outdoors during the summer heat waves, and we're going to get heat waves. During COVID, it becomes more challenging. Cooling centers is not going to be available because of the social distancing. So we know that people would suffer from heat stroke and heat death, heat as an injury, causing death. And so these are three examples where we need to reduce or work on reducing disease and death. The main factor is income. Guaranteed, anybody Googles public health, social determinant of health, the factors that determine the health of any individual, any family, any community. Guaranteed, top that list, you're going to find income. So the longer we go into mitigation or in lockdown, the more negative effects we're going to see from disease, comorbidities related to income. So we go back to that basic underlying principle, the balance between death and disease from the measures against COVID versus COVID, and really reflects into the application. Specifically in the beach situation, the ultimate goal going forward is to achieve safe reopening as fast as we can, as long as it is safe and reasonable. So from that point of view, if we go through certain specific dates, if there is potential mass gathering is a term used for hundreds of thousands of people on a small in a small space like a beach, that's gonna make it not feasible to have social distancing. On these specific dates, namely Canada Day or long weekend holidays during the summer, it is warranted to have measures to control the ability of people to have this social mass gathering. And it is the municipality's right to pass bylaws to implement such measures. One of them is modifying access to a beach, from limiting the number of the beach, limiting the activity, or up to closing the beach. That will be warranted, that will be appropriate, and it's within the right of the municipality. However, if or when we're looking at days or periods of time where there isn't potential for that gathering, it would not be warranted to close beaches. It will be warranted to focus on the main goal, safe opening as fast as we can. So that balance, choosing the time, choosing the intervention that's appropriate for that time. And I've used this term before, the least intrusive. If we can maintain the low number of people who are abiding by the regulation on a beach or in any space with certain training, certain education or warning or anything other than closure, let's start there. And if it's not achieving the goal, we can go to a closure. Nevertheless, regardless of the situation, I would strongly recommend every individual to follow the provincial orders and the municipal bylaws, regardless of the situation.
Thank you, Dr. Ara. Thank you. I'm going to pick up.
Drew, may I ask the doctor a point of clarification
Absolutely, go ahead.
on this very specific topic? And Doctor, what I'm thinking is, so we obviously are very focused on July 1st weekend, but with it falling on a Wednesday, the weekend before could very well be for many people their getaway weekend. The weekend after could very well be their getaway weekend. If we're talking 30, 40, 50,000, which is what the concern is those large gatherings, frankly, Sauble Beach is that every weekend. So the concern that some people are coming back to me, particularly the business community and the students who come back to earn their wages during the summertime, are what happens if this becomes every weekend of the summertime and we're going to close it? So I think that's kind of what you're alluding to, but I want to just be a bit more specific because I am getting lots of those types of calls put through my office. I trust Lisa and Alex are probably getting very similar, that, okay, we can understand. And I think you alluded to, if it was for 1 or 2 days of Canada Day and that's over and done and people knew they could plan the rest of it. But how do we contain and how do we know those crowds aren't going to be as big other weekends if you get a heat wave, if you get people who have planned their summer? We typically have a 10-week summer period when most of those seasonal businesses make their money. That's how they survive. That's how they actually keep their business. So my concern would be, and I'm being asked this, so it would be helpful if you could share, is what if there is no defined time period? How do those businesses plan? How do they actually keep their businesses going with no defined time of when they can't open?
That's a great question, and it really triggers an area that I didn't touch base on. We had weekends in the past few weeks, and these weekends had gatherings on the beach, and the epidemiology that we have is still favorable. The number of cases are low, and we continue to monitor the situation. So if we continue with similar weekends, I would have no issue reassuring the public that we are in really good standing. We have been working with businesses and the community business in Grey Bruce for the past 8 weeks, even before the word reopening became a word in the media. We've been at least 2 to 3 weeks proactively working with them. And I have seen the business community and the business owners investing every bit of energy to ensure their workplace safe for their employees and for the public. I have zero concern that we are not in good standing to proceed with safe reopening. So if there is, again, certain indications that mass gathering is going to happen, that is something that's going to be expected, tackled in different ways other than just closing everything on these long weekends. On normal weekends throughout the summer, I see no reason why not to proceed with the plan to have it open. That's our ultimate goal. And like Mr. Walker said, businesses operate on a plan. So if a person knows they're going to close for 1 day, they can work around it. If people are working with unlimited or indefinite closure, that is going to be very detrimental to businesses, and at the end of the day, detrimental to the health of people in Grey and Bruce. I don't know if that answers the question, Mr.
Yes, thank you very much. And I think, again, that's the balance that we're talking about. There's the ability for people to come up and enjoy and have pleasure. There's the ability for the businesses, and all of it has to be with a safety factor built into that. And it's great to hear your perspective on that, because I think that's what the public needs to understand. Your scope of practice is to make sure we're all safe. And I think we always need to refer back to you.
And there is an added point, if I may add, Drew. It's similar to the mask use in principle. It's an intervention. Is it needed? How much it's going to achieve? The mask use on hierarchy of efficacy is the lowest. The top is the physical distancing, after it engineering, then administrative solutions. PPEs depends on people use of them, is the least effective. So you apply the same principle to beach closures. So we close the beach. Does this mean people are not going to come? Probably they're going to come, and they're going to be in the community doing other activities. So if beach closure was a silver bullet, I will be mandated, trained to pull the trigger on that one. It is useful in certain occasions when there is a large number of people, and it might not be successful. At the end of the day, we might find 20, 30,000 people in the community, not on the beach. So again, we might have lost an opportunity for people to use the beach for the enjoyment that it would provide, for the mental health that would provide, for cooling during heat waves, for no added benefit, because people are going to be in the community either or, maybe in lower numbers. Nevertheless, it's not a silver bullet.
Thank you. I'm going to, that takes me to the next question. Another practice that's being introduced is the social bubble with 10 people and in their bubble. There's some questions around that, particularly how do you deal with children in childcare, daycare, who are part of one bubble, but are obviously interacting with other children in their daycare location. So just some discussion, if you would, around the social bubble and how people can maintain the safety of that social bubble.
I can take a first step at it from a science point of view. The social bubble is a concept that's really related to common sense. People socialize with limited number of people, feel comfortable with them, and that's the number 10 is not a magical number. It really comes from the fact that humanity are comfortable with number 10. It's the number of digits on our hands. And that's why the metric system is used, not the 16 system, which is probably, according to mathematician, is more effective. Nevertheless, the number 10 is useful from the point of view, if there is a case, it's so easy to trace. Contact management and tracing is a very complex process. It's a very effective, needed in the recovery phase as much as in the mitigation phase, and it has been implemented. It makes it that much easier to know any case. You call the same group. It's one phone call to notify all people, to identify the 10 people, maximum 10 people. So practically it is useful. Socially, it is the common sense. People socialize with few people. Some people might decide to have a social bubble of 200 on a normal day, but practically it's not everybody. Mental health requires us to have people who are comfortable, we trust, and that's a reasonable number. So there is a second part of it related to daycare. The same number is in place, probably for the ease of it. And the plan that presented by the recommendation by the province allows each health unit to modify the number or the implementation of daycare. All in all, it seems reasonable. In Grey Bruce, our direction is to go ahead with the same number and the recommendation from the province, and to continue to monitor and evaluate. There would be challenges, however, nothing is unmanageable.
Any of the members want to discuss their social bubble?
Yeah, I think I'll wade in two different cases, Drew. One is kind of what Dr. Eyre was alluding to, and certainly, or I get it in my office, that people do question why these numbers, why the limit, where this. And again, I'm going to go back to that word of balance. If you don't have some of the daycares open, how do people go back to work? And how do those parents get back into providing and creating that safe environment, right down to the proper food and all the other things for their children and their families? So we followed at the provincial level, for clarity, the medical officer of health for the province, Dr. Williams, and the health command table, who come out with a number. how I hadn't heard the 16 before Dr. Era, so that's kind of interesting. That's my number, but it's kind of cool. So I think it's that balancing of, yeah, you have to provide a number, you have to pick a number, and it's consistent. People at least know if I'm going to congregate, I know my limit's 10. And if you go to 11, 12, or 25, then you are breaking a law. And I think that makes it clear for the people. I think it makes it clear for police enforcement or by law enforcement. And I think you know that. In my social circle, I mean, think of the people on this call right now. It's been very difficult. People expect us to be everywhere at everything. How would we limit that to 10 people? But I think, as Dr. Era says, it's using that respect. It's using those basic principles of social distancing, of making sure that we know, of keeping track and limiting, frankly, which isn't real easy for a guy like Bill Walker to limit my social interaction with people. I love people. I love to be out all the time. And I you know, Lisa, Alex, myself, Paul, you know, we make our living by being out at as many events with as many people. So this has been a really drastic change for us. But I think the reality that I come back to is, if I can limit myself to not be out any more than I absolutely have to, then that's for the betterment of everyone, and that's for the good of the cause. And I'll do that. And I hope, and I think why we again go back to reiterate why we have some of the best numbers across our great province is because the people of Bruce Grey Owen Sound have adhered to a very similar mindset. We know the rules, we played within them, and we did it, I believe, out of the greater good and cause and concern for our fellow person.
And if I might add, yes, Bill, you are very social, but we appreciate that about you, and we all are. Let's be real. We all have our friends and family we want to connect with, but what we've heard on the call this evening is about the steps that need to be taken and the guidance that needs to be respected so we can move forward confidently. It's all about that confidence. And so I can tell you that in Grey Bruce and here in Perth, for that matter, rounding off my little corner of the region, we have managed testing incredibly well. And we're moving forward with contact tracing. And we saw an example of that just a couple of weeks ago. Grey Bruce Public Health, you facilitated testing, tracing, and ultimately contained what could have been a potential outbreak situation. And that's how we're going to get confidence. And I don't know whether we're breaking news here or not, Drew Ferguson, thinking about where you used to come from, CCANX. But Bill and I were very, very proud to hear that Grey Bruce is one of 5 regions in Ontario that's moving forward to further work through the methodology of contact tracing. And that's a huge compliment to Dr. Era, as well as the entire public health unit. So you need to be very proud and confident of the guidance that we're receiving right here at home.
Thank you.
Well, I appreciate those kudos. I've always regarded this organization as very forward-looking, and we have been at the forefront of many initiatives across the province, trying them out and focusing their efforts. So I'm getting down towards the end, but I want to look forward with the next question. The question seeks a little bit to hear about a little bit about herd immunity. Is it the silver bullet, and how do we get there? And that's maybe for you, Dr. Era.
Sure. Herd immunity is a term reflects the proportion of the population that if they become immune, the disease will not be circulating. And for COVID, it is around 70%, 70%. Immunity can be achieved in 2 ways. One, to acquire the real infection and recover. And the second one is through a vaccine. Measles one day was as scary or more scarier. This was scarier than COVID. It claimed lives of many children, Canadian children, before vaccine existed. When we had the vaccine, that herd immunity, although it's higher than 70%, it's around 92, 95%, was achieved. And you would see physicians who would go through their training and the entire career might not see a case of measles. So that will be the silver bullet we're looking for, herd immunity through a vaccine. According to CDC Atlanta Center of Disease Control. It's one of the most credible public health organizations in the globe, is their estimate is a vaccine that is safe and effective. These two words need to be in a vaccine: safe and effective. Will be available within 1 year from the description or the identification of the virus. So by the end of this year, it is probability, not just possibility, they have a vaccine. Usually it takes 3 to 6 months to produce it at mass amount to support the public. That's what we see in influenza annually. There is a new vaccine every year. It's identified from the virus that circulates in south of the equator in Australia, other countries. They identify it and they produce a vaccine that's going to work for the north later in the winter. Similarly with COVID, if we're successful to find the vaccine by the end of the year, 3 to 6 months, we would have the vaccine available for use. And just a piece of information about how sure CDC is. The first month, there were 11 candidate vaccines just by the first month. Last estimate, it was over 100. Not all of them are going to make it to the finish line. Vaccines go through 3 stages, 3 levels of clinical trials. The first one is used on volunteers just to ensure it's effective. It is safe. And the second stage is for the efficacy, and the third stage would be a bigger trial, clinical trial, to ensure both safety and efficacy with higher numbers. One of the vaccines in the first stage actually achieved the goal, which is the safety, and there was some data about efficacy, even though it's the first stage. So that doesn't mean we're going to have this vaccine at the end of the year. Rather, it is a really good result, because we could have had the result to say it's not safe, don't use it. 8 out of the 45 candidates developed enough level of immunity that would protect a person. There is always that other question after the herd immunity: how long would the immunity would last? With COVID, with the coronaviruses, usually it's 3 to 5 years. It's difficult to know how long this one would be, but there is no reason to believe it's not going to last for that long as well.
Thank you, Dr. Era. I'm cognizant of the time here, down to the last few minutes. So I'm going to ask each speaker for concluding remarks, or starting with you, Mr. Ruff.
Alex, you still there?
Yeah,
he's back.
Yeah, sorry about that, technical difficulties. So I just want to say thanks again for hosting this and getting this information out. It's always best to get facts and out there to as many people as possible. And this is just a great forum. There's so many different ways to get the message out, and I think this is a great way to get it out. So they're hearing it, they understand again that we're all working together. We're all sharing the same information. And again, thank you in particular to Dr. Era and to the whole Grey Bruce Health Unit for everything you're doing to help, to make, as it's clear, this region of the province one of the, knock on wood, best and lowest cases of COVID-19 in the province. So congratulations to that. And I think the one rule we all have to remember that goes with these health protocols: common sense. Just think before you do, what you're doing, and remember, think bigger than just your individual self. How is this going to impact others? So thanks again for having me.
Thank you for those words. Ms. Thompson.
Thank you very much. And again, I appreciate this opportunity to participate in a forum like this. It's so important that we can, no matter what our guidance is in terms of social distancing, we can literally reach into communities throughout the region. And I think there's a lot of value in that. So congratulations to the health unit for facilitating this. And I just want to share that, a very wise man once said on a Friday morning teleconference that, and one of them and that person is on the side of the monitor here. This wise person said, this virus isn't done with us yet. And so until such time that there's confidence in a vaccine, we all have to think about our friends, our family, and our communities. And in thinking about them, embrace the guidance that has been defined for us. Because by doing that, all of us collectively as a region, we're going to keep each other safe. Happy Canada Day, everyone.
Thank you, Ms. Thompson. Mr. Walker?
Thanks so much. I'll echo both Alex and Lisa, and Warden McQueen, Warden Mitch, who's not able to be on the call. It really is a level of all three levels working very collaboratively, very effectively. We have had as much communication, I think. Most of us joke that we probably talk to each other more than we do our spouses and closest family members, whether we had that 10-person bubble or didn't have that 10-person bubble. Dr. Again, I mean, Lisa and I sing your praises at the provincial level, and we're very sincere in that, because you have brought that level of leadership and integrity for me, certainly, and I can speak, I think, for all on the call, to understand your world, to understand what public health is all about, to understand the epidemiological and the medical side of things that aren't our expertise. We've deferred to you in most cases, all of us, for that leadership. The results speak for themselves, and I think equal to that are the people of Bruce Grey Island Sound who have adhered to your leadership, your team's leadership. And I think the one thing you've said on this call tonight, in addition to what Lisa just shared, is all of us have to pretend and feel that we are carrying that virus. And if we all do that, if we all take that extra thought process to say, how can I protect the person I'm sitting across from, standing across from, eating across from, then I think the collective benefit will be there at the end of the day. We can't let our guard down. That virus, as you have with so much wisdom told us, has not relented. We may be thinking it is, but it's not. It's out there. And I just think if we all, again, stick to our Bruce Grey Island Sound and Huron-Perth spirit, I think at the end of the day, we'll come through this. We will definitely come out the other side. And I think there's lots of good things that have came out of this that we, again, can't get lost in the shuffle. There's a lot of great things that have happened with companies, with individuals stepping up, truly showing that Canadian spirit. And I'll end on it on the same as Lise. Happy Canada Day. Happy every day to be Canadian. Thank you so much.
Warden McQueen?
I won't go on too long, but I will say it's about being safe. It's about working together collectively. And also, this is real. This is a real virus that's out here. And I will say that I think going back to Alex, he said about common sense, and that's what I think what we're doing best. And I will say that, again, from the leadership of Dr. Era, I know going back to those board meetings, I keep coming back to that in January and February, and him explaining this, going, what? And he was bang on. And you know what? I think one other thing I want to say is we were prepared as a region by having the Bayshore full of beds to accommodate. The same with Hanover and Kincardine. So far, we have not needed those, but it's better to be prepared and not need them than to need them and not be prepared. So I think we're very well prepared as a region, and that's, again, working collectively. Everybody, working with the science and the information that we have at hand, and we will continue to do that. And that's what's going to make us safe all the way through here.
Thank you, Warden McQueen. Any closing comments, Dr. Era?
Thank you all. Thank you I am honored again for every word you said. The real credit goes to the team and is directly related to the work you have invested. Many people don't know that the results that we have, or many people know, but might not see the direct link between the effort you have invested into the success that the region has. No question, the political commitment is key, is a cornerstone. My parting words to our listeners is related to a very basic fact. These viruses don't have wings or legs. They don't jump on people. They transmit through us touching a surface, or touching somebody's infected, or touching the surface that's infected, then touching ourselves. Washing hands is very important, and it really needs to continue to the last part of this stages of dealing with this reopening. And there is no need to be, there is a need to be concerned. There is no need to be worried. We have managed through the difficult part of it, and we have the means and the knowledge and the commitment to manage throughout. Again, I would remind people to be cognizant of their environment, to exercise social distancing, physical distancing, to wash their hands, to behave as if they are carrying the disease, to protect people around them, to protect their families and the community, and the most vulnerable of us, the older adults. Thank you all.
Thank you very much, Dr. Era. And thank you everyone for joining this Facebook Live event. As I stated at the outset, this has been recorded and will be posted on our YouTube channel. Any additional unanswered questions can be posted on our Contact Us page on our website. Again, the email address is publichealth@publichealthgraybruce.on.ca. One more task before we close. I'd ask everyone to join with Grey County at the conclusion of this event and make some noise. Make it in support of the graduations across the region. This is a community way to show appreciation for the graduates who are unable to meet formally. And with that, maybe Dr. Era's statement to the students is the fitting final words. These are exceptional circumstances, and they provide us with a unique viewpoint, and from it, an important life lesson.
We'll make some noise.
Well done.
Woohoo!
Thanks, Drew. Well done.
Thanks, Drew.
Yeah,
Well done. Well done, Drew. Thank you.
Thanks, Drew. Great moderation. Stay
Thank
safe,
you all.
everybody.
Yes.
Stay safe.
Care.